there therapies in development that are showing promise for patients with AML?
There are so many of those. It's hard to count, and this makes me very happy. There are exciting, again, targeted drugs. One drug class is called menin inhibitors, which were just published, that show high promise, and again, a very difficult to treat subgroup of patients who harbor chromosome changes in MLL genes in here. So that is a very exciting option. And there's a very exciting treatments with respect to what we call antibodies or monoclonal antibodies that attacks the surface proteins that are being checked regularly. And one of those, for example, is called magrolimab, and that has even promise in these high-risk leukemias or adverse risk leukemias. And then we are not there yet, but I'm sure we will be in the not too near future. There are also multiple trials that are looking at what we call CAR T cells, what patients might have heard about for lymphomas or for acute lymphoblastic leukemias. AML is a little bit more tricky with respect to those, but we have seen preclinical studies that look really exciting. And I think it's just going to be just a little bit of more fine-tuning to make those easier available and more targeted for AML patients. And I'm very much looking forward to see those come more onto the market.
You mentioned the new menin inhibitors. Who are they right for?
We try to find out more, but definitely for patients, it has been shown to be beneficial for patients who have chromosomal rearrangements of the MLL gene or KMT2A gene. And there are also good data on patients who have NPM1 mutations. Even though we know, and this is patients who harbor this kind of genetic change have now a plethora, which is great, of treatment options, because we know even conventional chemotherapy has been working decently well in them. We know that venetoclax also is supposed to work very well in them. But again, the data on the menin inhibitors with respect to NPM1 mutations is very exciting.